Dr. Randy Martin, and I'm joined now by Phyllis Supino. Phyllis is at SUNY Downstate, and Phyllis, you just gave a great talk on really sort of the epidemiology of valvular heart disease. Tell me, I know you spoke for 15 minutes, but tell me a little bit about what sort of is your overview on this.
Well, generally, valvular heart diseases have been underestimated. The prevalence of these diseases have been underestimated for a very long time. And there have been many studies that have attempted to estimate prevalence. I would say not very successfully, because these are very small studies of different patient populations. But what is now becoming apparent from population-based studies is that there is a much greater prevalence of valvular heart disease than was previously thought.
And you mentioned, and I don't mean to interrupt you, you mentioned obviously the aging population, the comorbidities of obesity and all that stuff. Is that important?
Well, the aging of the population is definitely important. Virtually every study that's examined the issue has found that there's a direct relation between valvular, except for the diseases due to infection. Right. There's a direct relationship between valvular heart disease and age. And those studies that have not looked at that, if you put them together and look at the populations, you see that as the population ages, you see an increase in valve disease. And that's true for mitral valve disease, right. It's true for all aortic valve disease, it's true for tricuspid regurgitation as well.
Phyllis, so it's an actual increase. It's not that we're just, the old question is, are we screening more patients? Are we scanning more patients? But it's actually an increase in the incidence of valvular disease.
It appears to be the case. Certainly, there is a direct link with aging, which is not an accident. Is it that we're screening more people and finding more? Probably. Is it that it's better documented now or recognized than it was before? Possibly, but certainly every study, there's very strong evidence it's related to age.
Tell me, and I know you mentioned it in your talk, what are the numbers? What percentage of people have valvular heart disease?
That's a wonderful question. It depends on what you call valvular disease.
Okay.
Right. If you call valvular disease anything that's definable by echocardiography, you can get ranges up from, say, 19% for mitral regurgitation, a lower percent for aortic regurgitation. If you define it as moderate to severe, the numbers come down somewhat. Okay. But it is still quite substantial.
And you've used the percentage of
2-3%, depending on 2-3 for clinically important, moderate to severe disease, about 2 to 3%.
You also made some interesting points. In the world, rheumatic heart disease is still a big deal.
It is.
And I was a little bit surprised you talked about where we're seeing rheumatic heart disease. Yes. I would have thought it was in the undeveloped countries and stuff like that. Tell me about that.
Yes, well, a few years ago, I undertook a study with medical students, and we looked at New York City. And the hypothesis was that immigrants from countries where valve disease is known to be highly prevalent would bring that disease with them here to New York City. So we have begun to conduct research, actually pretty much completed it, looking at the SPARCS database from New York State, and we found a very positive relationship between coming from a country or living in a zip code where there are many people from countries with rheumatic disease and actually having rheumatic valvular heart disease. Which is a big surprise, because my colleagues have thought this is gone.
Well, no, absolutely.
Vanquished. It's probably going to become a big player as I would say, over time. History.
You did. I want to thank you for joining me, and you did a great job with this. I appreciate all your good work in epidemiology, and thanks so much.
And thank you so much.
Good to see you. Thanks.